Late Night Health continues. I'm Mark Alyn. During the next hour, we're going to spend the time in my favorite city, Manhattan. In about 30 minutes, Marianne Ryan is returning to the show. We're going to talk about how sit-ups can actually injure you. She's a physical therapist. She's an author, TEDx speaker, and Marianne will be joining us again, talking to us about why sit-ups are bad and what to do to make a flat tummy. During the first part of the hour, we're going to talk about vitamin D with Dr. Kecia Gaither. She is a double board certified physician in New York City. She's an OBGYN, and I believe you have a specialty in maternal fetal medicine as well. Dr. Gaither, welcome to Late Night Health.
Thank you for having me. Appreciate it.
Let's talk about vitamin D in general, first of all, and then let's be specific. We, unfortunately, have not, and I'm embarrassed to say, have not targeted the African American or the Hispanic communities a lot, and we should do some more in that area. So I make a promise to you that I will do that in future episodes of Late Night Health. Vitamin D itself, we seem to have an epidemic of a lack of vitamin D. Am I correct in that?
To a certain extent, yes. I think that given the fact that society has now become more industrialized, where we're living in urban areas more so than in rural areas, our exposure to vitamin D has subsequently declined. Now, keep in mind, vitamin D is a vitamin that is made in our skin, and sunlight is necessary in order for that to happen. So if you are in an urban environment where you are under the shelter of skyscrapers, if you're taking underground transportation or even, over the ground transportation, you're in a covered area, so your sunlight exposure is limited.
I mean, let's face it. You're working in Manhattan. How often do you go to the park and sit there for 15 minutes, exposing your arms to sunlight? I mean, I would guesstimate that would not happen an awful lot.
Not a lot, and particularly not in the winter.
Yes, exactly.
Particularly not in the winter.
Right.
Everybody's bustled about and bustled up, so certainly not in the winter, but I can say I can get out sometime in the summer, but certainly not in the winter. And being of a darker hue, that additionally precludes you to making an ample amount of vitamin D because people of color just have a lower proclivity to making it. So if you are of a darker hue, if you're heavy and you're living in an urban environment, chances are you're likely vitamin D deficient. So let's talk about some of the things that vitamin D does for you. Vitamin D is important in a lot of your bodily functions, from your cardiovascular status to making, strong, healthy bones. It is a causality in depression. And in my arena of the world, it looks like it may be associated with having an increased proclivity for preterm labor. So that's where my interest in it lies.
And, of course, that means having a baby not in 9 months, but maybe 7.5 months.
Early, yeah.
Or early.
Preterm babies.
Preterm babies.
So that's why I'm pretty much interested in it. Being a physician in an urban environment, taking care of primarily Black and Hispanic patients, and knowing that in my area of the world there's a higher incidence of preterm labor. So I want to kind of get on board and see what are some things that can be done that can kind of decrease that incidence.
And we also have in general, a higher mortality rate for moms during birth, but African American women, women of color, apparently have an even greater chance of dying during birth.
That is true. there has been a number of studies and a number of news articles that have been put forth within the last, I'd say, 3 months, just talking about the same thing. And, it really is a dilemma as to why that is, and that cuts across all socioeconomic strata. So there's a question as to what really is going on.
Is that caused, do you think, by vitamin D, or is that just something that we don't know what's causing that?
I think, the high mortality rate in African American pregnant women, I think is multifactorial. I think a lot of it has to do with access to care early on. A lot of it has to do with diet, because there's a high incidence of obesity and diabetes, which in and of itself precludes you to having pregnancy complications. Additionally, hypertension, which again, that's kind of the number one thing that I see in my area of the world. There are a number of infectious morbidities such as HIV. And another thing that I'm seeing a lot of recently is hepatitis B and C, which I find kind of interesting. And then there's a lot of substance abuse. But again, it doesn't matter what economic strata, my patients fall into, whether or not they're on a higher socioeconomic end or a lower socioeconomic end. There does seem to be an increased proclivity of Black women to die of delivery complications than white women, and certainly it goes along the same rate with some Hispanic populations as well.
Is it that greater than the mortality than the white population?
Yes, it is.
Percentage-wise?
I would say so. I mean, we're looking at maybe a 3 to 4 times higher rate than Caucasian women.
That is amazing. And you mentioned a number of causes. Hepatitis is scary in itself right now.
Well, not necessarily a cause of death, but certainly it confers a higher morbidity for mom as well as baby. Pediatricians need to be aware of the mother's status at birth and, immunize the baby accordingly. But certainly hepatitis in and of itself can preclude, the liver damage. So that's something that I see a lot on the rise. And
there are different varieties or flavors, if you will, of hepatitis.
There's hepatitis B and hepatitis C. And B and C, C I'm seeing a lot more in my substance abusers. Certainly women that are IV drug abusers, and certainly see the B's and the C's a lot. So, and I certainly have my share of substance abusers.
And what about HIV in the same population?
HIV, actually, it's interesting. I would say if you asked me this question maybe about 10 years ago, I would have said I see more HIV than what I'm seeing now. HIV is now kind of a chronic illness, so I don't see as much as I did, I would say 10 years ago, just coming out of fellowship. However, now what I'm seeing is a lot more hepatitis, which I find interesting.
Yeah, that is interesting.
Syphilis is coming on the rise, too.
Back to vitamin D, is that something that all women, particularly African American women, should be tested for and should be taking a supplement for, in your opinion?
In my opinion, I think it would be a good idea, simply because if you're in an urban environment, just by virtue of the fact that you're in an urban environment, you're not getting the exposure to sunlight. And subsequent to that, if you're not getting adequate exposure, you're not making an adequate level of vitamin D. If you're heavy and of a darker hue, you certainly, need to have some degree of supplementation. And vitamin D, for the most part, isn't something that, you can get enough of in foods. There are a few foods that have a significant levels of vitamin D to deplete you if you are deficient. Certainly you can find vitamin D in milk and so forth and so on, milk products. But
again, in the African American Black community, Hispanic community, Jewish community, lactose intolerance.
Yeah.
So you're right.
Yeah.
Asian community too, I think.
Yeah, exactly.
Right.
So supplementation is inexpensive, and you can get vitamin D over the counter. Now, how do you know whether or not you're vitamin D deficient? Well, you assess your vitamin D levels, and you can do that two ways. You can ask your doctor to do it, or if you are of the inkling, that is something that you can do yourself. There's a great website by the name of nutrientpower.org where you can purchase kits to check your own vitamin D levels. And the other thing that's really good about this site is they talk a lot about vitamin supplementation, vitamin deficiencies. There's a lot of health-related information.
And that's at nutrientpower.org. All right, we're going to take a time out. We're going to come back. Our guest is Dr. Kecia Gaither, and she's an OBGYN and a specialist in maternal fetal medicine. We're talking about vitamin D and birth rates in the Black community. All right, Late Night Health continues. Join us at latenighthealth.com and facebook.com/Late Night Health Radio. Don't go away. We'll be back.
Welcome to Guide to the Soul. This is Robert Clancy. Opening your heart is the only way to allow all the light in. Unconditional love does exist, but it takes trust, something not a lot of people are willing to give. But how can you expect it if you don't provide it too? All hearts are refillable, rechargeable, and renewable. So why worry about being burned? By giving, you have everything to gain. Think of how beautiful your life would be if someone loved you without barriers, gave all of their heart to you without conditions, and wrapped their soul around you like it was your last day on earth. Today, you can be that person for someone else.
For more inspiration from Robert Clancy, visit guidetothesoul.com or go to the Moments with Robert page on latenighthealth.com.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.